people tend to feel more depressed during the winter season. It's cloudy. Okay. Does anyone ever feel depressed during like the spring and the summer?
We never gonna grow.
Well, if you feel depressed more during fall and winter time, you may be suffering from a disorder called seasonal affect disorder, or SAD, as it's conveniently called. And it's a type of depression that occurs roughly at the same time every year. And if you're like most people with seasonal affect disorder, your symptoms start in the fall, mid-fall, and may continue into the winter months. I know last year I had seasonal affect disorder, so that's why this topic was interesting to me. And the symptoms for fall and winter seasonal affect disorder, because there's also a version of it where there's seasonal affect disorder in the spring or early summer. But fall and winter seasonal affect disorder, or winter depression, symptoms include depression, hopelessness, anxiety, loss of energy, social withdrawal, oversleeping, loss of interest in activities you enjoyed, appetite changes, especially craving for carbohydrates or fatty foods, weight gain, and difficulty concentrating and processing information. Spring and summer symptoms include anxiety, insomnia or trouble sleeping, irritability, agitation, weight loss, poor appetite, and an increased sex drive. Doctors suggest that you shouldn't brush off the annual depression as a case of the winter blues, and treatments for it include light therapy, psychotherapy, and medication. And there's a case called reverse seasonal affect disorder, which is like they are signs of symptoms of mania, or a less intense form of mania called hypomania. And the symptoms for that include elevated mood, agitation, and rapid thoughts of speech. And it's a form of bipolar disorder, so if you have any of those symptoms, you may want to see your doctor. When you have a period of depression for a long period of time, that's when you should see your doctor. And your doctor may suggest that you use a light box therapy, which is effective on its own or may be used in combination with medication. Light therapy boxes you can pick up basically at mostly any drugstore, and or phototherapy boxes, you can ask the over-the-counter guy about those. But basically they mimic outdoor light, and it's thought to cause a chemical change in the brain where it lifts your mood and eases your symptoms of seasonal affect disorder. It can also be used to adjust your daily sleep cycles if you have trouble sleeping at the right time or staying asleep. And you just use them for 30 minutes or longer at the same time every morning, with light shining indirectly toward your eyes. You can buy, like I said before, you can buy a light box over the counter without a doctor's prescription. You can find it on the internet, and health insurance companies may require a prescription from your doctor to cover the cost. So if that's ever a problem, just talk to your doctor about it. Medications that are used to combat seasonal affect disorder include bupropion, which is Wellbutrin XL, and Zoloft, Paxil, Prozac, and Ethanol. Your doctor may recommend starting a treatment with an antidepressant before your symptoms appear every year if they're that serious, so you won't feel the depression and you can just go straight on with your life the way it is. Psychotherapy is a lesser used but still active form of treating SAD, and it's not exactly proven science, but it helps change your negative thoughts into more positive thoughts and helps you cope and manage with stress. So like I said before, seasonal affect disorder is a depression that occurs around the same time every year, and it it's treatments or light therapy, medication, or psychotherapy. And thank you very much.